I'm Carol Celine, talking with urologist Dr. Deborah Glassman. In your urology practice, you treat both men and women. What kinds of problems do they bring to your office?
Oh, it's very varied. Anything from voiding dysfunction, either going too often or not enough, blood in the urine, kidney stones, tumors of the urinary system are just a few examples.
Now, you're involved in a new kind of treatment for pelvic floor disorder. Could you explain what is pelvic floor disorder and what you're doing for it?
Sure. Well, pelvic floor disorders are actually a spectrum of syndromes that have to do with sometimes pain in the pelvis, voiding dysfunction, again, either too much or too little, and sometimes they can even be referred to as prostatitis for men or interstitial cystitis for women. And part of my philosophy is to use a multi-pronged approach rather than just medications in treating these patients. So I try to incorporate yoga or meditation, mindfulness, and some behavioral therapies to help improve their symptoms.
And do they work?
Well, unfortunately, the data is pretty sparse, but anecdotally, I would say that they do.
And do you find that your patients are willing to comply with that? Because it's a lot easier to take a pill than probably do some of the things you're describing.
I think some of them are really very much on the same page and are willing to try anything for an improvement in their quality of life.
Yeah. So I guess you sort of have to pick and choose the patients too.
Sure. Well, I try to offer everybody a variety of therapies and then tailor to the individual.
Where do you stand on the PSA controversy? Should men have them? Shouldn't they have them? There's so much in the news today, pro and con.
Well, I think it needs to be an individual discussion with the patient and their physician. Certainly broad recommendations are important, but mandating yes or no for everybody isn't the right answer.
It's hard if you're a guy to know when you should have a baseline, what kind of attention you should pay. So you're saying it's a very individualized thing?
I think so. I think it really requires a discussion between a physician and their patient because it is important for some men and not as important for others.
And is age an issue?
Age is an issue. Other medical conditions are an issue, but there shouldn't be an age cutoff, especially if you come from a long life of long livers.
So one final question. We all grew up being told we needed to drink 8 glasses of water a day. Is that really necessary?
I don't think so. I think you need to drink until your urine is pale yellow or clear, but it's going to vary every day for every person.
And I guess if you're thirsty, you drink.
Right.
Well, I won't need to carry that bottle of water around anymore. I enjoyed talking with you.
Thank you very much for having me.